Hi, it's Mary back with part 2 of sustained stretching for tight muscles. What I would like to reiterate is it's great when the kids are wearing their AFOs while they do this because it gives their heel cords a stretch. Also, sustained stretching is a much better alternative to passive range of motion or passive stretching, because we're only doing that for a short period of time. If we can sustain a position that gives a good stretch, it will be more effective. So that's what I'm showing you today. We've already done the sitting for the hamstrings. We've also done the straddling for the hip adductors right in here. Next, I'm going to show you how to stretch for the hip flexors. They are the muscles right here that get tight if you sit for a long time in different positions, like in wheelchairs, or they go from a wheelchair to a classroom chair and have that hip flexed a lot. So what you do is you take your child and you have them lay on their belly on the floor. And you can have them on their elbows, or you can have them just laying flat. You can also put a roll underneath their arms to help them prop up on their elbows. You want to take, usually if you're tight, you're going to be flexed up somehow. You want to take those legs and you want to bring them down together back here. When that happens, if they have tight hip flexors, their little bottom is going to pop up in the air a bit. Now, that's okay, but what you want is to position your child so that they're in this position, and that you either put, a little weighted blanket or your hand gently on their bottom and try to have gravity and a tiny bit of pressure push down and try to stretch. I'm going to really exaggerate it, stretch those hips. Now, you don't want to push really hard. You don't want to really, that would hurt your child. You don't want to push hard. You just want to gently relax your hand. You can play a game. You can play with toys. You can read a book. You can watch television. So they're up on their elbows and they're watching television or a video. And that will be a nice, 2, 3, 4, 5, 10-minute sustained stretch. What I'd like for you to do after you do that stretch is to have your child, take a look at your child's knees. You want to make sure they're not too red, because that's where the pressure will be when they're stretching. And if the redness goes away after 20 minutes, you know that was a perfect amount of time. Your child's skin's not getting impacted. But if it gets really red and the redness doesn't go away after 20 minutes, you know you went a little bit too long the first time, and to shorten it up the next time you do it. And keep checking that knee, above the knee. Usually it's like right above the knee or at the knee joint for redness, because you want to make sure the skin integrity stays nice. So again, you want your child on their elbows with a roll underneath if they need it to give them support, or without a roll, like this, with their head up on their elbows. If it's difficult for them and they just want to lay with their head to a side, and you can play this way, that's fine as well. Legs together, little bottom will pop up a bit. You want to put gentle pressure and just sustain that position for, as I said, 2 to 10 minutes. And that's the way to do a nice sustained stretch position and stretch out the hip flexors for your child. Give it a try. Bye-bye.